24 million people have this disease. And in a 5-year span, this disease has doubled. And if you're over 60, 1/4 of you have this disease. What is it? Well, today's program is entitled Diabetes and Epidemic. We'll be right back. Hi, welcome to Abundant Living. My name is Curtis Akins, your co-host for today. And this is my beautiful bride and wife and friend and partner in business relationship, Paula Akins.
That's a lot, honey.
I just ran out of adjectives. I think I just stopped there since, children may be watching too.
That's a lot.
Yes, but you are a lot to me. Partnership in our ministry.
Absolutely.
Absolutely.
And same here.
Yes, same here. Having a wonderful time.
Absolutely.
In our traveling.
Yes. And
yes.
we're hitting another heavy subject.
Another heavy subject.
And not only a subject that you made in the tease, you talked about a subject that as you get a little bit older. Mm-hmm. And what we're actually seeing now is we're seeing this whole thing of diabetes epidemic actually coming into the area of your teenagers and your young adults. And
yes.
So it's a very critical disease, and one in which can be prevented in many ways, especially when we're going to be talking about.
Yes. And again, this is the first part of a running series called Defeating Diabetes series. All right. So we're going to be doing diabetes, and we're going to be talking about the diabetes and carbohydrates, lifestyle reversal, neuropathy, nerve damage, and some other lifestyle modifications as well. So this is the first part of the Defeating Diabetes series. And as you mentioned before, children are also diagnosed with diabetes, and normally when the children is diagnosed with diabetes, usually before the age of 12, in most cases it's about type 1, over 90%. As we get older, you get more to type 2. We'll talk about that later on as well. But first off, let's talk about diabetes. Let's give a definition, honey. What's happening when a person is a diabetic?
Well, basically what happens is that when a person is defined as a diabetic, when the insulin that they are producing is either not enough or that they are actually producing it in amounts that it's not helping the system. Okay, so not enough, which means that they don't have enough of the insulin. And number two is that they could be making it, but when they're making it, it's still causing an issue with the body itself. Okay. And so type 1, type 2, they used to say insulin dependent, not insulin dependent. Well, two types. Insulin dependent or non-insulin dependent are the two types. And what I said earlier is that this has now moved down into the teenagers as well as the young adults, mainly because of lifestyle once again.
Okay, yeah, that's true. And again, this is now categorized and classified as an epidemic just several years ago now, because it's increasing at an increasing rate. And so, and there's other forms of diabetes, gestational diabetes, women are pregnant as well. And we talk about
that kind of goes away.
Right, and that kind of goes away once the baby is delivered. But again, but a lot of times, most people have type 2. That's over about 95%. Type 1 is about 5%. We'll talk about that as well as we go through this series, Defeating Diabetes. Now, as far as numbers are concerned, let's talk about some numbers, first of all, too. Now, again, this is fasting glucose. When you have fasting glucose from a 100 to 125, you consider to be pre-diabetic. Okay. 100 to 125, and of course, this is all in our workbook as well. And about 60 million people fall into that category. 60 million, all right? Now, once you reach 126 and beyond, then you're said to be a diabetic. And about 24 million people are in that category, and 18 are diagnosed, but another 6 million are undiagnosed. So you may be watching this program today. You may be in the 6 million percentile or number, and you may be a diabetic and don't even know it. 6 million is quite a lot of people.
It's a lot
and
of
so
people.
That's why testing is very important as far as that's concerned as well.
Well, you know, the thing is, I guess people always ask me the question about How exactly does this thing happen? What goes on inside the system? One of the things that we like to do on the Abundant Living Show and when we're doing our community programs is to actually show you know, what's going on in the body system. In this respect, when an individual takes in any kind of carbohydrate, simple or complex, you know, simple meaning something like, you know, your fruit kingdom, complex meaning something like, you know, your potatoes, your rice, we're talking that once those, they're called carbohydrates. Once it goes into the system, then what happens is the body, when that sugar comes in, it comes in as glucose. And from that glucose, the body, once again, is trying to send that glucose into the liver or into the muscle. Now, once it goes into the liver or the muscle, it's called glycogen. And that's, once again, a very complex type of sugar. And from there, it automatically alerts the pancreas. The pancreas is alerted as soon as that sugar, glucose comes into the system, that there is sugar in the blood. And with that in mind, the pancreas then sends out the insulin. And the insulin, of course, then moves it into those two areas, the muscle and or the liver. Now, anything in excess of what the body needs to have then goes automatically into fat stores. And that fat storage, it's there. Of course, there still might be a problem with sugar in the blood.
That's true.
And that's where the diabetes comes in. It has not gone appropriately to where it needs to go, and they're still in the bloodstream. So therefore, it is classified as sugar diabetes.
Yes, okay.
Right.
And again, we're going to talk about the sugar caused diabetes.
Yes.
We're going to haul off on that question because that's what I want to ask you.
Yes, yes, yes.
Because we use the term sugar diabetes.
Yes,
so,
yes.
But hold on to that question because it's coming. I think I want to ask you that question as well.
Let's talk about the health risk.
Okay. Now, folks, from head to toe, because blood is everywhere in the body, every organ, every gland needs blood for nutrients.
Right.
Therefore, every organ gland is affected by diabetes because glucose, when you say glucose, we meaning blood sugar. We use those terms interchangeably. It's going to affect every organ gland in the muscle, in the body from head to toe. And let's go to our first graphic because a lot of things are affected when a person is a type 2 diabetic. Let's go to the top picture there, as my wife said already. It's going to affect the muscle and also the liver. And of course, when we take in carbohydrates, then of course the carbohydrates turns into glucose and is stored in those two areas at the top, the muscle and the liver. And when it's stored there in those two areas, we call that glycogen. Now let's go to the brain. The brain needs glucose to think, to reason, to write, to read. Therefore, if we do not have the proper amount of glucose or do not have a tight control of our glucose, the brain will be affected by that as well. I'm going to skip the adipose tissue because I'm going to let my wife talk about that. I'm going to go over to the pancreas. Of course, we all know that the pancreas, now most people don't know that the pancreas produces insulin, but only by the beta cells.
Right.
Not the alpha cells, the beta cells. And the beta cells only comprise about 2 to 3% of the entire pancreas. So with that in mind, sometimes the pancreas beta cells are damaged. They cannot produce that insulin. So, of course, we become a diabetic because of high glucose in the bloodstream. Let's go back to that graph again because I want to talk about also the gastrointestinal tract, particularly the stomach. When there's glucose high in the bloodstream, it's also going to affect the nerves in the stomach. We call that gastroparesis, nerve damage. And later on in the next few weeks, we're going to be talking about diabetes and botanical medicine, neuropathy, nerve damage as well. So you can see that diabetes can affect a host of organs and glands in the body because every organ, every gland needs blood. If blood has a lot of glucose, blood sugar in it, it's going to affect every organ and gland as well. So it's a multifaceted disease.
Multifaceted. You know what? There is a question that someone asked, and they said, sugar diabetes. We're using those words constantly.
That's my question. I want to ask
diabetes.
You. Yes.
Well, go ahead and ask me the question.
Okay. Well, yeah, because a lot of people think that if they eat a lot of sugar, then they're going to get diabetes.
Absolutely.
So, can you help us out?
Well, I have
Yes
a report
or no?
here. I have a report.
Okay.
And it's asking a question, just like you just got finished saying, is sugar the culprit? Dr. James Anderson, medical doctor, professor of medicine and clinical nutrition at the University of Kentucky. he had two groups of individuals.
Okay.
The first group were lean, healthy men. And these men were doing a diet of 10% fat.
Okay.
And they were doing 1 pound of sugar a day.
Okay, wait a minute. Lean, healthy men.
Lean, healthy men.
10% of their diet was fat.
Was fat.
And they had 1 pound of sugar.
Yeah, 1 pound of sugar, that's like cookies,
in
cakes,
any,
and pies.
Right.
Okay,
A
1
lot
pound
of people
of
probably
sugar
want to get
daily.
into that study.
Well, let's just see what happens.
Okay.
Because then we have group 2.
Group
Now,
2.
group 2 was also lean, healthy men.
Okay.
But these men were given a diet of 65% fat.
Oh,
65% fat, all right?
Okay.
So
one group had low fat, high sugar,
right,
a pound.
Right.
The second group had high fat.
High fat.
But low amount
Very
of
low
sugar.
sugar, all right?
So you would assume, and most people would assume, that those individuals in group that had the high amount of sugar, the
yes.
1 pound of sugar, probably had more diabetics than the other group that had hardly any sugar. Is that true or not?
Well, the results.
The results.
Group 1,
Group
the
1.
ones who had the sugar, the high amount of sugar and low fat. This group did not produce not one diabetic.
Wait a minute. The
in
group
11
that
weeks.
had 1 pound of sugar did not produce one diabetic
right.
in 11 weeks.
That's what the stats say, none. However, group 2, the one that had the high amount of fat, 65% of their diet in fat, and a very low sugar content, produced a mild diabetics in less than 2 weeks.
Mild diabetics.
Now, I think because of the fact that people hear the word sugar diabetes, they think that means sugar.
It's the cause.
It just means
yes.
that sugar's in the blood. It just
Right.
means that sugar's in the blood, okay, but not the cause. However, what's happening is the 65% of that fat in the diet coming from processed foods,
Okay.
all right? And then, of course, your meat kingdom, your dairy kingdom, those together. What happens is that the fat in the blood then coats the cell.
Okay.
That the pancreas is sending in the insulin to go get that sugar into the cell itself. It can't do it because the cell is completely
Coated with
surrounded
fat.
by fat.
Okay.
And with that in mind, then of course, diabetes.
Okay.
Okay.
I think Dr. James Anderson, University of Kentucky.
Yep. Professor of medicine.
Yes. Okay. We knew him.
Clinical nutrition. We know him personally.
Yeah, he came to our house, spent the night. Yeah. Okay.
Yes.
Wonderful.
But,
and he's the same guy who some of you remember the oat bran craze back in the 70s.
Yes.
Well, that's Dr.
Same
James
person.
Anderson.
Yes.
Okay. Do that.
Heavily involved in talking about, once again, plant-based diet. Okay, plant-based diet is one of the things that he also talks about as well.
Yes, okay.
So
now, I want to, before you go into the next questions or whatever you have there, because diabetes is a multifaceted disease.
Right.
That affects a lot of organs and glands in the body. Let's go to the next graphic because it also affects the heart as well. Again, when glucose is high in the bloodstream, it makes our red blood cells very stiff and rigid, as you see there. So with that in mind, those red blood cells being very stiff and rigid, if there's any cholesterol deposits in the bloodstream, it's going to have a very difficult time going through that cholesterol deposits or that plaque that we talked about in later weeks gone by. So with that in mind, if a person's a diabetic, they have a 2 to 4 times greater risk of a heart attack and a stroke because of that. Diabetes is also, now get this folks, the leading cause of adult blindness. The leading cause of renal failure. Amputations, some 72,000 amputations per year. All right. I worked at Huntsville Hospital for 9 years, and the one surgical procedure that I dread the most was amputations, assisting in that surgical procedure. And I mean, I have a leg in my hand that's a very eerie feeling, you know, and sometimes the foot, I mean, it looks black and necrosis is dead tissue, so it's just very damaging. So that's why we're doing this program or this series, Defeating Diabetes, in a series over the next several weeks, because we need to gain control of diabetes and defeat this disease.
I know one of the things, we've done this in our community, and you've done the foot, and then you've also done the eye.
Yeah.
And I think by the time the foot and the eye come up on the screen, I think the people are ready to make some changes.
Yeah, I started to have some of those pictures on the screen here, but this program probably would not air because it's very graphic.
So you didn't bring any more graphics with you?
I didn't bring it. Yeah, but you know, dovetailing what you said about the fat now.
Yes.
Because when fat goes up, the risk of diabetes goes up proportionally. Let's go to our first graphic, and this is a graphic of the United States, and let's look at it this time. Now, this is the United States, and so with that in mind, this is the United States and the obese rate. So therefore, with that in mind, you see at the bottom part of the United States in the south central region where it's more blackened, that means there's more obese in those areas than any other area in the United States. So you see there, I know this is a worldwide program here, but you have probably Louisiana, most of Mississippi, a great part of Alabama, parts of Georgia, some Tennessee there as well. Those are the states that has at least 30% of their individuals who are obese. Now, keeping that in mind, look at that map very carefully. Let's go to the next map, because the next map is the diabetes map. And you see there, it's almost the same area as the map for obesity. So as obese goes up, so does diabetes goes up as well. You just explained that because the fat coats the cell. So that's why we did a series again, the winning weight series, as far as how to lose that weight as well.
Well, I guess the next question is, what are the warning signs? What are the warning signs that an individual can look?
There are a lot of warning signs, and it really depends on the type of diabetes you have, type 1 or type 2. They're kind of different, but some of the warning signs are excessive thirst, constant urination, blurred vision, slow healing cuts, tingling, prickling, numbness in the fingers and the toes. Those are some of the warning signs that a person may be a diabetic, and that's why testing is very important.
Now, that's a lot.
Yes.
Okay.
And we cover some of the testing in our workbook, so you can just read that and find out.
And along with that, we talk about something in the epidemic, diabetes epidemic, then we know that we're going to be, as we go through this series, we'll be talking about things that we can do and signs we'll look at, and we're going to go over this again and again with you. But you know, it's time to go in the kitchen. And we're going in the kitchen, and we're going to be doing a black bean. And on top of that, we're going to also do some plantain. I'm not sure if you've seen that before or not, but let me tell you something. Black beans and plantains, oh yes.
Oh yes.
Get your paper and your pencil and meet us in the kitchen. Well, welcome back.
Okay.
We're going to be making a black bean dish, and we're also going to be working on plantains at the same time. So let's look at the recipe.
Okay.
Black beans, 2 15-ounce cans of black beans drained and rinsed, 4 garlic cloves minced, 1 small banana pepper seeded and minced, 2/3 cups of orange juice, 2 tablespoons of lime juice, 3 tablespoons of cilantro leaves minced, 1 tablespoon of olive oil, and sea salt to taste. Now for the plantain, we just need 2 large plantains and 1 tablespoon of olive oil. Now this is a real good one. This is a Caribbean dish.
Caribbean?
Yes, a Caribbean dish. And I'm going to get started because I'm going to go ahead on and put on, I want you to get that line ready for me.
Okay.
And I'm going to go ahead on and get the beans together. We're going to just start off by just putting the olive oil in.
With the whole juice of the lime?
Yes, both of them, please. There's your little gadget you like.
All right.
Okay. We've got the oil going in. I'm also, hey, talk about 2 things at one time. Let's get the plantain. We're going to go ahead and put the olive oil over there as well. Get
Caribbean
that one started.
Dish. Jamaican. You mean you talk with a Jamaican accent?
No,
we don't have to?
I don't think you need to go there.
We don't need to go there?
No.
Okay.
My friend Ann, they might get you. They might get you.
Oh, your friend, I just realized who you're talking about.
Now, for the plantain, all I'm going to do is I've got the plantain already cut up and everything to put in here. I'm going to just actually cook it on both sides until it gets like a nice golden color brown. And then Kurt's got that lime ready for the to go inside the bean dish. Let's get this ready too. We got things cooking on the stove, 2 things cooking on the stove at the same time here.
Oh, you working it, baby.
No, we ain't playing. Let's look at that garlic in.
That's the garlic.
And the banana peppers
peppers. They're not hot, are they?
No. And we're going to go ahead and put in, why don't you go ahead and put the beans, go ahead and do the beans now while it's popping. All right. Oh, that smell good?
Yes, it does.
All right, we're going to turn that fire down. Down.
And black beans doesn't cost that much, do they? You get a pound
No,
for what? Maybe
it does not.
90 cents or so?
It doesn't cost that much. And on top of it, you can also buy the dry, like we said before, you can buy the dry black beans and cook them in your crock pot.
Okay.
And you get the same thing. Ooh, you smell that? Ooh,
yeah.
Mercy. Mercy.
Mercy
okay.
sakes.
Want to take that plastic off of there for me, honey?
Okay.
I'm going to go ahead on and put the orange juice in. It's 2/3 cups of orange juice.
Now, how do you look, what do you look for when you're purchasing the plantain? Any particular?
You want to make sure that they're already yellow. I mean,
okay.
if you're going to do this particular recipe, they need to be yellow, okay?
All
this
right.
is going to go ahead on and simmer for a few minutes before I put that cilantro in. So we put that lid on.
Okay.
And then for the plantain, you want to make sure that they're, like I say, a yellowish color. The yellow,
okay.
more yellow, the more sugar. As it starts getting real dark, the skin itself, it starts getting that black color, it's even more sugar in it. You know, we're going to be talking on our show as we continue in this area of diabetes. We're going to be talking about the fiber, the importance of fiber, and
yes.
the natural sugars that are actually occurring in the food. So
yes.
let me go ahead and put those plantains in.
Okay.
Okay.
So you're just going to brown those on both sides?
On both sides.
Okay.
Okay. Whoops. Whoops, 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 whoops. One jumped in there.
Then you're going to put the plantain in with the black beans?
No.
Oh.
At the end of the show, they're going to see these two in two separate dishes.
Oh, two separate
but
dishes.
a combination of how they both can look good as a trio.
That's a trio.
There's a third item coming in as well.
Oh, I see.
Mm-hmm.
Okay. All
now,
right.
so he's going to brown them, like I said, on each side. Let's check on. I'm going to go ahead on. I see the black beans are doing well. And you got that lime. Why don't you go ahead on and pour the lime in?
It's ready.
Wow, that's going to be a good combination.
Yes,
Orange juice
is.
and lime juice together.
Got quite a bit of it.
Mm-hmm. Let's keep on. All right. Okay. And then last but not least is going to be the cilantro leaves. Go ahead and put that in.
Okay. This is going to be a very good dish.
Very pretty.
Very pretty.
Yeah.
Yes.
All right. All right. Now we're looking for our time.
Okay, we've got a few minutes.
Okay. So what we're going to do, I don't want all the juice to go out of this because I want a little bit to be left over. But what's going to happen is it's going to cook down, I guess, about a good maybe 10 minutes or so. You're going to cook it. Make sure you keep it on simmer. And then while that's going on, let's just see what's happening to our plantains over here. Already turned that a pretty golden color.
Now you use canola oil.
No. I use olive oil.
Oh, olive, because it has the flavor?
Yeah.
Okay.
Yeah. And you can use canola also
right.
as well, okay, on this. Everything is looking good. And we're going to be, like I said before, we're going to be talking about the importance of fiber, the importance of natural sugars, the importance of which we're going to get from the different kingdoms. And you're going to see that when we get to the next part of our program, which is a continuation of where we have left off. How about that?
Okay.
Isn't that pretty?
Yeah.
Pretty colors?
Now both of these are in your cookbook?
Both are in the cookbook. This one plantain, let's do it. Let's do it. Okay, there you go. All right. And look, I'm going to tell you something right now, Curtis. The more yellow or the more blacker the skin, the sweeter the plantain actually is. And there are people
the more blacker, the sweeter.
Yeah, when that plantain
the natural sugars comes out.
The more natural sugars come out.
Okay.
Be nice and sweet. You don't have to add anything else to it. If you have people say sometimes to me, you know, what about a cholesterol issue? I said, then you can spray your pan. Just spray your pan, and you can still do the exact same thing with the cooking spray.
Okay.
All right? Okay.
All right.
So everything is looking good.
Okay.
And you know what? We're going to go away, and when we come back, you will see the finished product. So stay by. Well, we have finished this dish.
Yes, looks good, honey.
I mentioned it was going to be an accompanied trio.
Yeah, trio.
Which wound up being the brown
rice.
So it's
the brown rice, okay.
Brown rice.
Nice accompaniment with the black beans and the plantain, and everything looks good.
Yep, the black beans have banana peppers in it, and it has the cilantro. It also has orange juice and lime in it, and it has garlic, and all these things help to make it come alive.
You know, a lot of people, they fix black beans or just beans in general, just a little bit of salt, and that's about it. So you just made it come alive with all those other seasonings and spices and herbs and things like that. And
it's a good company with the plantain. I like the plantain also. And you'll see that it's got a real nice flavor.
It really does, yes. Now, I want to see whether or not the flavor is in the plantain and also in the black beans and the rice.
I knew you were going to say that.
Can you prove the flavor?
I knew you were going to go there. I knew you were going to go there. So,
can you hook a brother up?
And so I decided
to
bring out the plantain.
Now that's all I'm going to get, just those 3 or what?
Well,
okay. Why are you cutting that in half?
Well, I'm going to try it first.
Okay, I thought Adam was before Eve. Adam was before Eve, baby.
You keep saying that.
Okay, and you keep eating.
Nice and sweet.
Nice and soft too. Yeah.
Now. Hold up.
Black beans.
I knew you was gonna say something about the black beans, so so I thought I'd just go ahead and get those out too.
Okay. What now? Remember in our reception of a wedding, you fed me first.
Did I?
Yes. I know it's been 16 years ago, but okay. Yeah. 1 hour on the clock.
Is there orange juice and that lime in there?
It's different with that lime in there. Yes, that's nice pizzazz.
You had to get this recipe. I'll tell you that right
well, you
now.
know, this is part of the Defeating Diabetes series, and in the coming weeks we're going to be talking about diabetes and carbohydrates. That's always a hot topic. Also, diabetes and reversing lifestyle, a helping lifestyle in reversing diabetes. I should say that. Also, diabetes and botanical medicine.
Good.
Neuropathy and things like that. So I want to stay tuned for those coming programs in the coming weeks.
We're going to have some good recipes and all the ones as well. We're going to have some good recipes.
Yes, it has a good program. Well, as always, John 10:10, Jesus said, I come, that they might have life and have it more abundantly. See you next time.